Stroke is a disorder in which the blood flow to the brain is compromised or diminished. Hemorrhagic stroke is a stroke caused by the rupture of a blood vessel, whereas a stroke caused by a blockage is known as an ischemic stroke. An absence of blood flow results in the brain's inability to obtain oxygen and nutrients, leading to the damage of some brain cells. The condition impairs the ability of bodily components that are controlled by nerves connecting to the damaged brain to function. A stroke is an emergency that needs to be treated right away since it can cause damage to brain cells in just a few minutes. With timely and effective treatment, possible problems can be averted and the extent of brain damage can be mitigated. Ischemic stroke and hemorrhagic stroke are the two types of stroke that are classified according to their underlying causes. Traumatic happens when brain blood arteries burst, resulting in hemorrhage. Numerous disorders affecting the blood arteries might cause bleeding in the brain. For instance, unchecked hypertension, weakened blood vessel walls, and blood thinner use. 3 factors increase a person's risk of having a stroke, including health factors, lifestyle, and other factors. Apart from stroke, these various factors also increase the risk of heart attack. Those included in health risk factors, such as hypertension, diabetes, obesity, heart disease, high cholesterol, and sleep apnea. Lifestyle risk factors for stroke include smoking, lack of exercise or physical activity, consumption of illegal drugs, alcohol addiction. Several conditions that are included in other risk factors are hereditary factors. Someone with a family member who has had a stroke has a higher risk of experiencing the same disease. Age factor. As people get older, a person's risk of suffering a stroke is also higher compared to younger people. Each part of the brain is responsible for controlling different parts throughout the body, so stroke symptoms depend on the part of the brain affected and the level of damage. Therefore, stroke symptoms can vary from person to person. However, stroke usually occurs suddenly. There are at least 3 main symptoms of stroke that are easy to recognize, which are, one side of the face will look lower and the sufferer will not be able to smile because the mouth or eyes appear droopy. The sufferer is unable to lift one arm because it feels weak or numb. Not only the arm, but the cramp on the same side as the arm also experiences weakness. The speech becomes unclear, confused, or even unable to speak at all even though the sufferer appears conscious. Other stroke symptoms and warning indicators include nausea and vomiting. Severe headache that comes suddenly, accompanied by stiffness in the neck and dizziness as if spinning, vertigo. Decreased consciousness. Difficulty swallowing, resulting in choking. Experiencing problems with balance and coordination. Experiencing sudden loss of vision or double vision. Various stroke prevention measures include keeping the diet. Consuming too much salty and fatty foods can increase the amount of cholesterol in the blood and the risk of hypertension, which can lead to stroke. Avoid excessive salt consumption. Furthermore, the recommended foods are foods that are rich in unsaturated fats, protein, vitamins, and fiber. All these nutrients can be obtained from vegetables, fruit, whole grains, and low-fat meats such as skinless chicken breast.